Good morning. I am Dr. Nidhi Aggarwal. I am a consultant gynecologist who is based in Gurgaon. Now, today I'll speak on polycystic ovarian disease, that is PCOD, which is very common in women these days. PCOD actually occurs in young women. They usually present to us with irregularity in their periods. The ovaries in PCOD patients actually become bigger and denser. As the name suggests, poly means many, that is, many cysts are formed in the ovaries. The lady usually presents with disruption in the normal menstrual cycle. Now, what happens in a normal lady who menstruates every month? There is one egg which is selected by the nature, which increases in size, and when it becomes bigger and appropriate in size, it is ruptured from the ovary, which is then taken up by the fallopian tube. And if it doesn't meet the sperm and pregnancy doesn't occur, then the lady menstruates. This should happen monthly, up to 35 days. In PCOD patients, this natural selection of the egg every month doesn't occur. Instead, many small cysts are formed in the ovaries. So that is why there are many cysts formed in the ovaries, and then the patient does not have normal periods. That is why we say it is polycystic ovarian disease. Now, how does a patient of PCOD present to us? A patient of PCOD, if she is a young girl in her teens or in the early 20s, she usually comes to us saying that she is not having her monthly periods. She usually menstruates at 1.5 months, 2 months, 2.5 months, and when she comes and when she menstruates, she usually has excessive bleeding with clots. If a lady is in her late 20s, she has got married and she is not able to conceive, then also the patient presents with problem in conceiving. Also, there is usually an excess of hormones produced by the ovaries, that is excess of the estrogen as well as the androgens, which is the male hormones. The lady usually presents with male-like pattern of hair growth, that is hair growth on her chin, on her face, around her nipples of the breast, on her lower abdomen, especially under her umbilicus, over her thighs. And she says that along with excessive hair growth, she has developed excessive acne, and there is also hair loss over her scalp. These are basically because of an excess of androgens, that is the male hormones. This change in the hormonal milieu occurs because of polycystic ovarian disease. Also, very often patient comes to us saying that she is gaining weight excessively. Patient comes and says, in the last 5 months I have gained 10 kgs of weight. So patients usually present to us with symptoms of insulin resistance, in which there is overweight and obesity present. Now, PCOD has become actually very common. I have patients who are as small as 11-12 years of age coming to me, young girls presenting with PCOD, and the incidence is really very high. 1 out of 10 women nowadays are having PCOD in one time. How do we diagnose that a lady has got PCOD? See, there are 3 criteria which are very important. As I have told you, first is that the lady is not ovulating. That is, the egg which is formed every month is not rupturing from her ovary. Instead, there are multiple eggs formed, multiple cysts which we call in the ovaries. So, if the ultrasound shows that they are polycystic ovaries, if the patient presents to us with less ovulation, anovulation, which we say, or oligo-ovulation, which occurs when the patient is not having her regular periods, and there are signs of excess androgen, that is male hormone growth, with features of hirsutism, then out of these 3, if 2 criteria are there, we label the lady as having PCOD. Now, very often the patient asks me, why am I suffering from PCOD? So, if you ask me, there is no one particular cause which I can say that this is the reason you have got. There are so many factors. It could be just genetic. If your mother or sister has been suffering from PCOD, your chances of having PCO are always high. There could be just a low-grade inflammation in your ovaries, which has disturbed the ovaries to an extent that it is releasing more of male hormones. They will become bigger in size, and that is causing the ovaries not to ovulate. Or it could be just because of obesity and high insulin levels. Again, because of high insulin in the body, there is stress on the ovaries and they don't ovulate. So there are so many causes. We have to investigate the patient. There are a lot of investigations which have to be done, and we can come to a diagnosis. Yes, there is PCOD. So I just conclude by saying that PCOD is very, very common nowadays. If you have any problem with your menstrual cycles, if you are gaining weight abnormally, if you have excessive hair growth anywhere which is not expected in a female, excess acne or hair loss, please do see us, see your local gynecologist, so that if there is any problem, it can be well sorted out in time. I am Dr. Nidhi, as I have already told you. I am based in Gurgaon, and you can contact me for any queries on PCOD or its treatment at Lybrate Clinic, which is in Galleria Market, and also you can contact me through Lybrate.